Good day, listeners of Beyond the Checkbox. My name is Ryan Todd. I am your host, and today we check in with Dr. Rahim Kachra, who is an internist. He is on the front line, and we had a podcast with him 1 year ago where he explored trying to get ready for COVID, trying to prepare hospital wards for COVID, trying to train non-ICU doctors and non-internist doctors for COVID. What a world that was. And it is a year later, and we have had the distinct pleasure of checking in with Dr. Kachra again. He's been gracious enough to join us on an exploration of what it is like to be a physician during a pandemic, during these times when we need resilience the most. I think we've all been feeling it, right? We've all been, you know, into the second wave and the third wave of COVID, and we all are struggling on how to think about this, if it will end, when it will end, and when we can return to normal. And Dr. Cash is here to share his thoughts of what it's like to be on the front line, the edge of the tip of the spear when it comes to working with our most vulnerable members in our community who have had COVID. So thank you for listening today. I am Ryan Todd, and this is Beyond the Checkbox, where you learn how to integrate more mental wellness into your organization. Well, let's talk. We're a year out. We're a year since we did our last interview, give or take, since the first outbreak. We were in the second wave, and we're kind of coming down from that. Like, where are we at? Give us a state of the union in terms of, where you think the workflow is, where you think the stress of the medical system is. Last we talked, were you were prepping, and you were training other doctors to take on COVID cases, and God forbid you had to train some psychiatrists to do some frontline medical work because we were so worried about capacity. You were in charge of a team that was looking at clearing out units to endure some of the capacity that we had no idea if it was going to come on or not because we just had no idea. So what has the last year been like for you?
Yeah, we didn't have a blueprint. I wish we did. I wish, there was a TV show that went through this exactly and we could just take notes and watch it and go through it in the exact same order they did. But we didn't have one. And it was impossible to predict at times what our flow was going to be like in the hospital. I think, in answer to the first part of your question, it was really neat to see the way nice mug, Michael Scott. It was really nice to see the way the medical community came together. In the first wave, if we can call it that, the general internal medicine docs really had to run the show, putting in extra time, extra hours, being up all night running COVID services on top of additional services that we already staff in the hospital. And as time progressed, and more so over the last few months, we've seen support from everyone in the hospital, whether it's an emerge doc, an anesthesiologist, a non-internist, kind of stepping up and helping us run the COVID units, reducing the strain on internal medicine as a specialty in specific, or in particular, I think is the right word. My English isn't very good. But I think that was the biggest thing, to see the community come together as healthcare workers and realize that everyone had something to offer, and it didn't have to fall on one group of physicians to provide all of that care. There was an opportunity for other physicians to come join us on the units, take care of patients, and do it in such a way that we weren't burning out one group specifically.
I found it interesting, when this first launched in March, April, May, COVID launched, the grand opening of COVID. There was so much rhetoric about healthcare heroes and thank you healthcare workers, and people are putting signs up around the hospital. People are putting signs in their windows and thank you to our heroes. Um, that obviously like died down because we're not professional athletes. But like, have you seen a shift in the mentality of physicians? Have you like how have you seen your own process change? I personally was so vigilant at the start of this, like over the top. Like every piece of clothing I wore had to go directly into the wash. I was like using that kind of bleach wipe on every single device, despite I don't know if there was evidence to suggest that that was an effective thing. My mindset was so over the top vigilant in the first kind of 3 to 4 months, and then that, like, I don't know, for better or worse, it's kind of tailed off. I'm still following the rules, still very vigilant, but like my mindset has changed around this. Have you found yourself to have a shift in mindset since this started?
Let me ask you a question, even though I'm not the psychiatrist here, nor am I the host of this show. But you're saying you think your mindset has shifted. Do you think instead some of those practices you were doing with vigilance in the first 3 or 4 months have now just become a regular part of your life, or do you actually think that you're paying less attention to detail than you were in the first 3 or 4 months of the pandemic?
Yeah, it could be that, right? Like I recall very distinctly how weird it was to see everyone in the hospital wear a mask. And now you see someone without a mask every once in a while, and it's like a visitor who doesn't know the deal, and you're like, whoa, whoa, like it's really weird. So yeah, I think there's something to that our mindset has shifted just that this is like normal. And now like I wear goggles and a mask every moment that I'm in the hospital. I think you probably do as well, and face shields. But that's just like a total normal thing now.
Yeah, I mean, even if I'm changing my mask between patients and I have my mask off for 15 or 20 seconds, I feel naked. I feel like I'm doing
Yeah.
something wrong. I feel like my face is uncovered. How dare I? And so yeah, I think you're right. I think a part of it is maybe we're paying less attention to things, but maybe that's because they've become more ingrained as a mindset. And there's these specific schemas we have in our workflow that allow us to operate in a safe way. I think I was similar at the beginning in terms of just being cognizant of everything I touched. And someone once told me, pretend that everything you touch has COVID on it. And if you behave that way, you're going to stay safe. And since then, we've had a lot of studies showing, where COVID lives in the environment, how you can get it, those sorts of things. But I don't think I've really changed the way I approach um, safety, I guess, in the realm of the hospital. If I can keep my 6 feet from people, even when I'm seeing patients and taking a history, I'll do that. I'll be wearing a mask. I'll be wearing eye protection, and vigilance with hand washing. You should see my hands right now. They're dry and cracked, and I try not to shake anyone's hand. Not only because you're not supposed to, but the complexion is important. That being said, I think in response to the other part of your question, I struggle with where we are all at as a community right now, right? The Canadian Medical Association did a survey of its members in 2018, so pre-pandemic, and at that time, 30% were burnt out, a third had depression, and we know from data in the U.S. and Canada that physicians have the highest rate of suicide out of every profession, right? I think the stat in 2018 was that every day one physician takes their own life. It was, I think, between 20 and 40 physicians per 100,000. And that was compared to the population of about 12 per 100,000. So we're in a high stress environment where burnout and depression and mental health concerns were there before COVID. I can't even imagine how my colleagues are feeling throwing a pandemic on top of all of it, and mixing in emotions of self-worth in the context of how we're viewed in the political system, mixing in the rhetoric you read on social media. Many of my colleagues have deleted their Twitter accounts, stopped going on Facebook, stopped reading some of the stuff that's out there. Because I think what's often forgotten is that not only are we physicians, but we're people too, and trying to function within the communities in which we live, but at the same time have the added responsibility of taking care of patients in the hospital. And I think it's becoming challenging for a lot of people to reconcile that in their own minds. We recently did a survey of medical students and residents internationally, and the levels of anxiety in medical students and residents is high. And to the medical students, we asked them a specific question about where they were worried about getting COVID. And the vast majority were more concerned that they would get COVID in the community than they would in the hospital, right? And I think that speaks to kind of the mindset of where people are at. I go to the hospital, I actually feel safe. I go to a grocery store, I'm kind of scared, right? And I think it's because the hospital has been really good at maintaining mandatory masking, eye protection for physicians, and trying to reduce the opportunities we have for contact. We're going for net zero cases in hospital spread, and the community doesn't operate on the same sorts of strict goals. And I think that does make a difference in the mentality of how physicians are behaving on a daily basis.
Yeah, there's a lot there, man. Like the pressure that physicians are under, the political environment and how physicians are perceived in that political environment. How have you been dealing with that? Like the endurance needed, I think, is incredible at this point, right? Like it's been a year, and actually we don't totally know. We don't have a crystal ball. We don't actually know when this will end and things will return to normal if they ever do. I also have noticed that in my conversations with other physicians just in the hospital, like one thing that physicians, I think, do really well to take care of themselves is go on holiday and travel, right? That's it. Some physicians become a physician so they can make enough money to see the world. Like that's, and like help people see the world, do all that. But that's the thing. And physicians can't travel right now. So I've noticed so many doctors saying like, man, I just want to, I just like, I need to get away, because you're right. You're in your community, you're in your like COVID bubble. And I think that's been really hard on the mindset. And I do worry about the suicide rates. It's increased. And so I guess I'm wondering how you've coped throughout all this. What have you been doing? How have you been hanging in there throughout this, being on the front lines of it all?
Yeah, that's a great question that I'm not going to have a sexy answer for you for. I I think as a result of how I've grown up, for me it's just head down and work hard and get through this at some point. I'm in that camp. I was told early in my career, it was a Sunday night, and the head of one of our sections of medicine came up to me at 9:30 on a ward, and he asked me what I was doing there. I said, well, I'm working. And I'm like, what are you doing here? And he was like, well, the same thing, but make sure you take care of yourself. Like, you're too early in your career to get burnt out. And I was like, well, how do you do that? Like, how do I take care of myself? Because I feel like the expectations, and they're heightened now during COVID, is if you want something done, ask a busy person. And so you're always being asked to do more. You're not getting paid more. All you get out of it is this personal satisfaction. But at some point that starts to impinge upon your personal life. And I think that's why we see some of these mental health concerns amongst physicians and residents. And so, the advice he gave me was take a vacation, take 2 weeks at a time, because it'll take you 1 week to turn off, and you'll get to enjoy your vacation for the second week. And so I took his advice and I did it. And I took 2 weeks. So actually I took 1 week off, and around day 5, I finally put away my laptop. I finally stopped writing papers and checking my email. And I really enjoyed the last, day of my vacation before I was gearing up to fly back. But what really got me excited was while we were on that vacation, we ran into a couple who told us, plan your next vacation when you're on your current vacation, so you always have something to look forward to. So we started doing that. And that was actually something that really has helped me pre-pandemic deal with the stress and the responsibilities on a daily basis. I think there are multiple different types of lives that physicians lead, right? Some are just see patients, others do research, others are heavily involved in the academic world, whether it's education or scholarship. And your life isn't just seeing patients. And at some point, one does give you a break from the other, but you do need a break from all of it. And I think that's been a struggle for me during COVID, is I don't really have an escape. Can't even go for dinner to forget about things just for one night. And, for the past few weeks, my inbox is averaging 80 to 120 emails a day. And so I know if I take a night off, or if I take a day off, or even if I, stop to watch an Oilers game in the evening without my laptop, that's just 30 more emails I'll have to deal with the next day. And my mindset is it better to take a break, or is it better to just keep going so I don't really fall underneath this massive pile of work that I will never catch up on. And I've taken the latter approach, that just keep trucking on slowly every day, and hope for a better future. I know
Hey,
that's probably not the right answer to tell a
no, there's
psychiatrist.
no right answer. And like, this is,
I think it's ingrained in the medical training, and it's rewarded. Like we always talk about the unwritten curriculum in medical school training, and there's something about like being the most hardcore in medical school that's really rewarded, and residency for sure. Like being the latest person there, and you always hear these stories of um, like I remember working in this one clinic where like the doctors and the residents had their white coats, and if you put the white coat on the rack, that means you were going home, right? There was a soft rule that the residents could not put their white coats on before the staff could. And that's not like a wild thing. You're basically not allowed to go home before your staff as a resident. And you're definitely not allowed to go home as a medical student before your resident. So that culture of like just staying the latest and who's the toughest and most hardcore and putting your head down to work is really common, and it's trained into the practice, which I think shows up in things like suicide rates, because doctors do such a terrible job of taking care of themselves. There's numerous other professions that I see this in, like lawyers, financial analysts, leadership across a broad range of organizations. There's there's an attitude like whoever works the most wins. And I think this is where the bullet hits the bone. Like this is where the stress points are, is when we've been in a pandemic for a year and we've just had our head down for a year, and there's no like thing to kind of escape to, which is like a holiday. So yeah, I'm kind of worried, and I don't know exactly what the solution is, because physicians and those in healthcare too sometimes are some of the worst at allowing ourselves to take care of ourselves. I don't know what to do about it.
Yeah. I see two sides to this. So I think on one hand, medical school and residency is essentially an apprenticeship, right? The more you're there, the more you see, the more you learn, the better you'll take care of patients at the end of the day. That being said, I think I'm seeing a shift, especially even pre-pandemic, where we were, looking at prioritizing things like wellness in our trainings. When I was a trainee not that long ago, wellness was a swear word, and now it's kind of a part of your everyday practice. I don't think we've come close to figuring out how to maintain adequate wellness in training, but at least the conversation has now been opened and we're trying, right? I also see that side of things where I'm often told, don't have the same expectations of the trainees that you have of yourself, because I think I'm a terrible role model at that, because I'm the one who stays late. I'm the one who has high expectations. I'm the one who's trying to put in work, but those expectations are of myself. They're not of others. And I think you're right. I think that's been ingrained in me, I think even before medical school. And now at some point that's going to punish me, right? And then you contrast that with, what do I get out of it, right? And I think that's why we're seeing a shift. My first 5 years of practice, I wanted to work hard. I wanted to be the one who stayed till the end of the day. I wanted to provide the best care I could for my patients, and I still do. But you also see people who aren't working as hard as you, and the rewards and the acknowledgement of the work is essentially the same. So how long are you going to depend on someone's own intrinsic feelings of satisfaction and self-worth, and their own altruism to get through, right? Because those who are more altruistic, those who are more intrinsically motivated at the end of the day, are sometimes the ones that are burning out faster, because there's nothing to acknowledge the work they're doing, and they're just doing it. And then, on top of that, you throw in complicated things like how physicians are paid and how physicians are valued by governments. And there is a group of physicians who does catch the short end of the stick, right? And then you're expecting them to keep doing more for less. And I think that's where you see a lot more of this burnout coming, these feelings of inequity, these feelings of, F this, I'm out. And I'm seeing that more and more lately amongst my colleagues. And it's the high performing ones. It's the ones that, take on this leadership job and that leadership job and have, either research or educational output on top of providing excellent patient care. And I think the system's not set up to reward people for the work they do. And in fact, you can argue that those that don't work as hard are actually the ones who are getting rewarded because they have time outside of work, outside of the hospital to spend with their families and move on. But I don't think either group's at fault. I don't think either group is right. I think that's a very personal decision that everyone has to make, and it's an evolution through your training and through your years of practice. So, I said a lot, but I don't really know what I was saying there, other than it's very complicated, and I don't think there is a simple solution because everyone comes at it from a different perspective.
I think there's something around a reward system, like our intrinsic and extrinsic rewards. I've always been really motivated and motivated to learn more about that, and just interested to know what like moves people and why you, for example, would be motivated to work that extra, like stay till 9:30. Like when you were staying every day late on the ward, what was it that kept you there, right? There was a combination of probably like a social reward from your staff being like, Rahim is a go-getter. He's the one that's going to be relied upon. He's going to get the best residency position. He's going to be hired soonest. There's also like the carrot of like, I guess, the financial reward when you're a physician. The thing I think is so stark about training versus working as a physician is that like point system that you have, like you in medical school and residency, there's always a point system. You pass or fail, you literally get evaluated out of 5 on each rotation. So you have like it's a game. You're trying to get the highest score. That's a driver. And then you become staff and that just stops, like instantly stops. And there's a bit of like an existential moment. You're like, what was I working for in the last 10 years to become a physician? And now where am I? And of course there's an element of like, I want to do what's best for my patients and my community, et cetera. But I found that really stark, that how much I was driven by that point system when I was a resident and a medical student. And then all of a sudden, I only realized it when it instantly stopped. And I wonder how many physicians grapple with the rewards versus inputs of a physician, because the inputs are so extreme compared to what we would otherwise call normal life. Very extreme inputs. I wonder what reward systems we're using now. And then take COVID, you put it in there, it's all thrown on its ear because it's just day in, day out patients, day in, day out kind of work at the hospital.
Yeah, and Ryan, I think you're missing 2 other drivers, one being guilt and the other being fear. And I think guilt plays a role, at least it did for me. When I was a resident, I stayed late, I put in the work, I chased that hidden curriculum of a point system, NYD, or not yet diagnosed. And now I'm staff, and I feel guilty if I'm leaving early. I actually do. And the nurses and the nursing aides and allied health on the unit, when they see me leave at a normalish or late to normalish hour, they're all shocked. And this is after working on that unit for 6 years. They're still shocked if I leave at 6 or 6:30. And so I think part of it is maybe there's some entrained guilt. On the other hand, you could argue maybe I'm not working efficiently enough during the day and I need to stay late to finish my work. I don't think that's the case, but you could argue that. And then fear, right? And then I think especially during medical school and residency, there's a bit of fear, right? It's, you're dealing with someone's life and you don't want to make a mistake and you don't want to leave, and you want to put in that work and you want to keep reading around the patient. You want to, keep chatting with them and understand their illness process to make sure you can provide the best care possible for them. And I always have a bit of fear that I'm not doing that. And when I don't do that and I deviate from my processes, it's harder to live with that fear than it is with sleep deprivation for the week that I'm on service and putting in, 80 to 100 hours. And so I think if you had a list of all the motivators that people had, I think you'd see the full spectrum. And I'm not sure how you would, classify them, but I'm not sure any 2 people have the same motivation at any, same phase of their lives.
That's interesting. The guilt and the fear. Wow. Yeah. I think that is so active in residency too, because one is trying to get a job, and in like surgical residencies where there's less jobs, the pressure and the guilt and the fear is like ramped way up. I was pretty fortunate in psychiatry. I think it's a more gentle residency program than internal medicine, which can be totally brutal, and the surgical programs, which are very brutal and a lot of shame-based learning and a lot of like guilt-driven kind of behavior. But yeah, I didn't actually consider that. The bottom line, I think, for me is that this all undercuts one's ability to promote wellness in that space. Like it's such an afterthought, I think, with this certain population and with so many populations that we work with, and I named a couple of them. I think it's an absolute afterthought, which it provides a real challenge in times of extreme adversity to then really promote wellness to prevent really serious things from happening.
So let me throw something at you. So, I don't want to use a war analogy. Okay, so we have a battle in our backyard, right? It's called COVID. This is our space as healthcare workers to really band together and fight a disease process in our own backyards, right? And there's this feeling of belonging and wanting to contribute to that battle in your backyard, and we're the ones who are poised to do it, right? And so I think a part of it is you feel responsible that this is actually your battle to fight. And some of us have put in 120-hour work weeks to fight that battle for a number of months of the last year. But we do that with a smile because we realize that this is our space, and if we don't do it, who's going to do it, right? And so I appreciate that there needs to be some gas in the tank so we can last for the months or years now that this pandemic is going to threaten us for, right? We have to have some gas in the tank for whatever challenge comes after this. And I think the hard part is, how do you take a finite resource, which is the number of healthcare workers you have in this space, and deal with an infinite problem that has no predictability, that has no, it doesn't care how many hours we have on our contracts, right? At the end of the day, we're going to put in the extra time to deal with the problem at hand. But how do you balance wellness with that, with a finite resource, with a finite number of trainees, with a finite number of physicians? I think that's the challenge that leads to wellness struggles in healthcare. I don't think anyone's tried to tackle that. I think we're so deep in the problem at hand that no one's really taken a step back and has looked at this as a workforce issue and said, okay, here's the group that's working hard. Now we also expect them to zoom out and see how they can solve this problem to provide wellness for everybody. But not only is this the group that's working hard in the trenches, it's the group that's designing the education, it's the group that's taking care of the patients, it's the group that's doing the scheduling, it's the group that's trying to maintain their own semblance of wellness, right? And at what point does someone zoom out and help us out and say, okay, here are the wellness issues we're seeing, here's some suggestions on how we can operationalize better workflow so you can feel better, right? But we don't really do that. And I think it's because A, we don't have time, and B, that's not how we're trained, right? We're trained to put your head down and work hard. And there's, like I said, there's a battle in our backyard. It's a pandemic. And if there's ever a time to step up as a physician, that's now, right? But I think what we also learned from that global study I alluded to earlier is not everyone feels that way. And so, maybe we don't need to be painting the entire profession with the same brush. Maybe we need to take a step back and say, hey, who wants to work in this space? Who wants to work in this space? And I think over the last few months, we've done that, but I don't think we've utilized everyone to their strengths, right? Instead of putting a psychiatrist on the COVID unit, should we carve out some time for the psychiatrist to, help design wellness initiatives to keep physicians safe and healthy and address the mental health issues that we know are inevitably going to come up, right? And I don't know if we've done that as a bigger team. I think we focused on the disease process of COVID. I don't know if we focused as much on the overall mental health aspects that are plaguing physicians at the same time.
And do you find physicians are, this might be a kind of an obtuse question. Do you find that physicians are very purpose-driven individuals? I guess that's something I guess I have missed in our conversation so far, is that like that sense of purpose and community around fighting this battle is probably a huge driver as well, a huge motivation for continuing to put your head down day in, day out, 120-hour work weeks just to get it done. Um, and then personally, I've always found when I'm like sort of come into that burnout kind of phase where I'm a bit in the red zone, it's because I'm doubling down on my purpose driven activities and living so intensely in that kind of purpose stuff that I love to do that it just kind of overwhelms me. Um, and then I kind of have to retreat and, take some time or do whatever it is. But do you find that physicians in general are very purpose driven individuals?
I think so, but I think that purpose is different for everyone, right? No secret. There are people who are driven by a number of things, whether it's family commitments, whether it's their personal belief about their role as service to society, whether it's financial, whether it's ego, and I think everyone is purpose driven, but I don't know what that purpose is for everyone. I'm not even sure what at this phase, after a year of this, and after um, over commitments on my own part, I often wonder what drives me and what the purpose that's driving me to keep accepting new roles and working harder and extending my workday is. And I don't know the answer to that yet.
Yeah, no, it's such an incredibly tough balance. Um, the thing I think is interesting too about the physician kind of trajectory in their career is none of these things are like advertised, really. Like it's just that I think a certain type of individual is self-selected into that pool, and there's type or a very specific type of personality that gets into the grade 1 of medical school that eventually turns into grade 12 and a graduate, and that same person continues to be turned out of the system, which is a pretty type A, pretty motivated, very purpose driven, and typically resilient, and somebody who would like work themselves into the ground. I think that's a pretty common phenotype of a physician.
Yeah, I think we're seeing changes in that. I think we're seeing people who enter, residency programs saying, I want to work X number of hours a day, and I realize, part of this is a means to an end. I think that's totally fine. But I have a question. I mean, you bring up resilience, but we always talk about burnout and where we are on this burnout scale. I guess my question for you is, at what point do we need to be teaching more about resilience so we can get through a pandemic, rather than the sole focus being on identifying burnout and where we are on the spectrum, but then not having tools on how to navigate that space? I'm turning into the host.
Yeah, no, it's a perfect question, right? Like we often not often, but we'll sometimes run into groups that are actually in opposition to resilience training. And what they say is we have to look at the system. It's the system's fault. It's the employer who's putting all this strain and stress on the individual. It's not the individual's fault in needing to be more resilient. It's the system. So I think there is a tension between, what in our current structure of work, what do we do? Do we train that individual to be more resilient? I think yes, because adversity is something we all face almost continuously for some of us. Versus do we change that system? I think there's strong arguments to say that it doesn't matter how much you change a system, you still need individuals to be resilient and resilient training, and choose resilient individuals and train them and skill them up in terms of those things. I think we do a very poor job of training resilience. That's like, I think why Headversity exists, and probably why we're doing this podcast right now, right? Is because we've traditionally done a very poor job of arming individuals with those skills. And now we have the technology and the know-how to do it. So that's what's being done. I don't know what your thought is on that. Like, on the system versus individual thing, where do you align?
I think the system aspects, how do I say this? I think the reason it's almost easier to identify systemic barriers is because A, we can't change those, and B, it places the locus of control externally, right? And so I think that's why the system is often brought up as a problem. We know the system is a problem, right? We know the current, political and healthcare structure is not set up to promote wellness and resilience, right? But we also know there are behavioral indicators, occupational indicators, and very personal indicators of things that promote resilience and wellness in your own space. And so I see the point of blaming the system. It's very easy to blame the system, but I think at some point there needs to be insights into what's within our control and what isn't within our control. And what the last year has made very clear is that from a system and political perspective, there's very little we can change, right? Where I think we're learning where to draw on resilience from is from within. It's from our own structures. It's from our own individual social networks. It's not coming from external sources at all.
I wonder too, like we talk about the workforce. 70% of the workforce right now in North America said this is the most stressful time in their career, and there is an enormous amount of death and destruction as a result of this pandemic. And you made the wartime analogy, which I think is an interesting one and an apt one at times. And I wonder how like wartime physicians dealt with, with being overseas for 2 years, and dealing with that. Like imagine that for endurance, imagine that for resilience, or dealing with not just wounded soldiers, but the like famine and disease and everything that comes along with war. I often wonder how we have so much access to data and surveys and understanding how we're doing right here and now. I wonder if you had those same tools to like survey physicians during World War II, what their resilience would be like and how they dealt with things and how they understood the system versus the individual. I don't know. I think those were probably some very resilient individuals.
Yeah, and I can't even imagine how they got through that, right? And last year, you and I were talking about pre-Ptsd or pre-traumatic stress disorder, and I think the next wave we're going to see is some PTSD in healthcare workers from how the pandemic has impacted them, right? From the patients they've seen to their own personal trials and tribulations. I don't think this is over once vaccines are distributed and we see the number of cases drop in our hospitals and it fades into the background like any other seasonal illness. I don't think this is the end of it. I think we're going to see this for quite some time, and I think that's going to be in the space of PTSD, if I can use that term, but more of the mental anguish that will follow. I think we're going to see a lot of people change the way they practice as a result of this past year. I think we're going to see people change what they prioritize as a result of this past year, and I don't think the workforce is going to look the same moving forward. I don't.
What do you think the changes are going to be? If you could speculate on in healthcare, in our workplace, what do you think the changes will be?
I can't speak for, I don't know if I can speak to that globally. I think for myself, I can say that I think I'm going to try to work less. I think I'm going to try to enjoy time outside of the hospital more. I think I'm going to, try to focus on things that have value in my life outside of the hospital, which I neglected for the last, 13 years now since I started medical school. And I think this has been a nice reminder for me that while it's been really, fulfilling to be in the position that I'm in during a pandemic, that there are other facets of my life that also require attention, that also depend on me. And being selfless is part of my nature, but I think being selfless doesn't just mean being selfless in a healthcare setting, but it also means in a personal and family setting as well. I always think about that, the analogy of being on an airplane, right? Put the oxygen mask on yourself first before you give it to the person next to you. And I worry that this past year has taught us all that, maybe we do need to put the oxygen mask on ourselves first because we haven't been in medicine. We haven't been.
Has COVID taught you about that or taught you a hard lesson around that? Why now? Like you've been doing this for 13 years. Why is that realization coming to you now? Not as an accusation as to something you've done wrong or right. I'm wondering what it has been about COVID that's punched that home for you.
I just think this is the first time I'm starting to understand what burnout is, right? I think, culturally and from my upbringing, there's no such thing. You just put your head down, you just work, right? And I think just living through the last year has just made me reevaluate things on a personal level and start thinking about what I want my life to look like in 2, 3, or 5 years from now. And I don't think that's what it's looked like over the last 5 years. I think the idea that we're sold of self-sacrifice or self-flagellation, as some of my colleagues put it, it's not a safe long-term strategy. I think you can only work the way some of us have been for so long before you either pull shoot completely or really start to reevaluate how you're doing things. I just think I'm at that point in my career where I need to reevaluate, what I'm doing, how I'm doing it, and how long it's meant to take me on a given work week.
Do you think that would have happened without COVID? Like, do you think you would have come to this, I don't know, 20 years into your career, not 13 years into your career?
I don't know. I have colleagues that are much more senior than me that I'm not sure have come into it yet. Right? I do think getting married over the summer was another motivator that helped me see what was outside of the workplace and what I've been missing and what I've been neglecting. So I think it was just kind of this perfect storm of a year to help me start to reevaluate, the direction of my of the next 20 to 30 years of my career, assuming I survive that long.
I think you'll be around. Yeah, I think they'll keep you for that long. So I hope you do. And it's been really interesting to hear your perspective on COVID, your personal perspective. And I want to thank you for joining us to share that. I want to thank you also for telling us, giving us a bit of a state of the union and an update on physician wellness and where it's at, and helping us understand what that archetype of a physician is like, and how you're processing this really extreme series of events, which we don't really know when that's exactly going to end. So thanks for joining us today. And I pray that we do not have another podcast a year from now where we're still talking about COVID. Please, let's not have that happen.
So what I'm hearing is that this is the last time you're inviting me to be a guest on Beyond the Checkbox.
You're done.
Right. Well, I guess I didn't do that good of a job. I'm no Kelly Rudy.
He was very good. I would love to have you back. Let's just talk about other stuff. Let's talk about hockey next time. Let's talk about that 3-week vacation. Would you ever take a 3-week vacation? My goodness.
That'd be
I've done it once, maybe twice, and it was more so as a gift to my parents for helping me get to where I am and all the sacrifices they made to help me succeed. And it was a bit long, not because I was with my parents, but 3 weeks is a long time, I think, to be away from home. But yeah, no, I would consider it. 6 months in Hawaii on a sabbatical. I wouldn't say no to that, to be honest. But yeah, nice. No, I agree. Let's do another one, and let's talk about hockey and a break from Calgary Flames talk in this city.
Well, I want to thank you, of course, for all the work you're doing, all the hard work you're doing. We appreciate it as community members who are benefiting from your sacrifice as a member of the medical community. So thank you for everything that you're sacrificing and all your training and continuing to be resilient through this really difficult time. So thank you, and thanks for joining us on the show today.
Thanks, Ryan. And I don't think you need to thank me for most of those things. Literally at the end of the day, I chose this career, or this career chose me. I'm very happy to be doing what I'm doing. I'm very humble that I'm in a position to help in the way I can. And I don't think my job is any more important or any less important than everyone else who's helping our society function on a daily basis. So I appreciate the sentiment. I struggled with the whole healthcare hero label, last year. And I still think, we're just doing our best, whether you're on the cleaning staff of the hospital, making sure high touch surfaces are clean, or the grocery store employee keeping the shelves stocked, or a podcast host. I think everyone has their space in the society we live in, and I think we're all on the same page. Yeah,
I agree with you there. I don't think we can understate the importance of the podcast hosts.
I would agree 100%. 100%.
I think they're the true heroes. They're the unsung heroes.
You know what? I think we should start a podcast host 10% discount at local retailers. Like, let's get that trending.
I've tried. I've walked into the grocery store and asked for a they don't give it to me. Not yet. So that's something there. I agree. Let's get on it. Awesome, man. Thanks for your time today. Appreciate it.
No worries, brother.
That was an excellent conversation. Dr. Kachra obviously was conversational and relaxed and ready to really dive into the intricacies of what it is like to be a physician on the front line. The conversation took a turn where we started talking about what it's like to go through medical school and residency and the ethos behind training a doctor and what our motivations are in difficult times and times when we need endurance. And I really enjoyed that part of the conversation. Maybe it was cathartic for me. There are elements of my training as a physician that I haven't totally explored or understood very well. But, the bottom line is that physicians are trained in a very traditional way to endure and sometimes endure physical and emotional discomfort to be there for their patients. And Dr. Kachra was able to really outline that in such an interesting way. I was grateful for the conversation. I was grateful for him to give us an update on where he is personally in this journey, because he is a frontline worker of all frontline workers. He's an essential worker. He is working day in, day out with patients who have COVID. He is a true frontline working hero. And, it also gave me an opportunity just to thank him for all the work that he's doing in our hospitals and taking care of our citizens day in, day out. I was very grateful for Dr. Kachra to connect with us today, and I hope you enjoyed this session. I hope you continue to enjoy Beyond the Checkbox, where you learn how to integrate more mental wellness into your organization. We have an excellent series of episodes coming up, some of them related to COVID, some of them not, all having to do with getting more mental wellness, more resilience into your organization. As always, we are very thankful for you viewing and listening to our podcast, wherever podcasts can be listened to, and sharing our content, getting it across LinkedIn, Twitter, Facebook, wherever you share content, liking and subscribing to all of our channels. Thank you very much. This show is nothing without you. Please continue to give us the mounds of feedback that you do in the engagement, because that's where we continue to grow and get you what you need to learn how to integrate more mental wellness into your organization. Thank you for joining. My name is Ryan Todd, and this is Beyond the Checkbox.